So my name is Anna Maria Mihalta. I have been a student since 2006. I'm a physician in internal medicine, and my background is actually in cancer research. And throughout my medical career, I've always had a lot of questions because things would happen to me during patient care that I could not explain, like, waking up from a dream at 3 a.m. and there's a patient who just appears and standing at, the side of my bed, and I go to work the next morning and that patient deceased at 3 a.m. in the morning. And I could never talk to anybody about that with my colleagues. So I found the school, and many of my questions were answered because they explained to me the spiritual aspect as well as the science of healing. So we have learned here in the school different techniques that were very specific in terms of applying them to healing. I'm going to just mention the names. So neighborhood walk, blue body. And what happened with me was that I did not specifically apply those in healing. I applied the techniques to help myself in many different areas of my life, but never to healing, because I thought, I'm young and healthy. And last year in May, my partner found that there was something abnormal in my abdomen, and I went to see my doctors, and I did have a grapefruit-size ovarian mass in my abdomen and a uterine mass, and they were very concerning for ovarian cancer. And so I was in shock. I did at that time not have the confidence to say, hey, I've learned these teachings and I'm going to heal myself instantly. It was not like that at all. So I decided to go ahead and have surgery. And I augmented my healing journey with the disciplines and the techniques that I've learned here at school. So initially, my biggest focus was that I did not want to undergo chemotherapy or radiation, and that I wanted to make sure that this is not a malignancy that has spread. I had some findings on my CT scan that were suggesting that lymph node enlargement, for example, and an elevated tumor marker. So while going to the doctor and then actually having surgery, my focused intent was to create a benign outcome. And I did manifest that. My tumor was a stage 1A, which means it had not metastasized. The tumor was removed. And after that, I had significant post-operative complications, very difficult ones. And they consisted of internal bleeding, and there was a lymph vessel that was cut during the surgery that was leaking, and that was not healing up. And in a second hospitalization, where I had to go back, they put some drains in my abdomen because this thing was not healing and it was growing. So I had another new grapefruit-sized mass. It's called a lymphocele that was draining fluid into outside of my body, and it didn't stop. I continued to go to see my doctors. I was absolutely diligent with my follow-up and applying the disciplines of the school to help myself to heal this thing. This lymphocele, lymph vessels do not heal spontaneously. You would have to go back in and somehow, try to close that. I had multiple procedures done that failed and they were unable to solve this problem. And I was very, very desperate in that situation and in a lot of pain. And needless to say, I wasn't working. So continuously applying a technique called field work that really allowed me to disconnect from my extreme pain, and during that time, able to improve my walking and my healing. I continued to use the techniques, and I was hospitalized again at the University of Washington. This was my third hospitalization for a week each. At the University of Washington, there was a team of experts that were discussing my case to see how would they operate on this leaking lymph vessel so it would stop draining, because every other treatment I had failed. So I continued to use my discipline of the neighborhood walk while I was on the hospital ward. I had morphine dripping in on one arm, antibiotics around the clock on the other arm, and focusing on I have always been radiant health and I do not need another surgery. And so the week progressed, and what was interesting about it was that either the experts were having arguments on how to deal with me, or certain tests were delayed, and finally I had another procedure done to change the drain. And the radiologist said, no, this drain is right in place, and your lymphocytes stopped draining. So after 1 week, it actually had healed off, and that is not something that would be doable medical. It was a miracle that occurred. So there was a complete healing of drainage, where previously I was losing like 2 liters of fluid out of this drain per week. It completely stopped draining. I had a follow-up CT scan. I continued to focus. A month later, this tumor was completely gone. It had disappeared. So they were also watching my left ovary because I had internal bleeding and I had some changes there. And I went for a follow-up ultrasound, and the radiologist came to me and said, I don't know what happened with you, but your left ovary has grown significantly. It's now almost 10 centimeters, which is grapefruit size. And you have developed a duct, a connection that isn't supposed to be there. It's called a fistula, and that would be a surgical, it would require another surgical intervention. What I had understood through the teachings here in the school was that what was creating the problem in my body were my attitudes, my anger, my control in my life, how I was unhappy with myself, and that I was continuously attempting to change those things through the disciplines, because they were the things that were creating the problem. And after I had this experience of knowing that I've healed the lymphocyte, and then listening to another teaching by J.Z. Knight that really taught me that I can do this, I can apply this, and I need to continuously self-correct. Self-correct is a discipline here that basically interrupts an old pattern of thinking that is harmful and says, no, I'm not going to be that person anymore. So I applied that very, very diligently and continued to focus on radiant health. And I had a follow-up MRI scan 1 week later that showed that the left mass was completely dissolved and the left ovary was normal. and that no fistula was found. What is very important, and one of the questions that somebody posed to me, is that I never advertised not having medical treatment. I had medical treatment. I followed up with my physicians and underwent an extraordinary healing as a physician by becoming a very humbled patient. What the disciplines allowed me to do was augment my healing journey, and then by continuously applying them, increase my own confidence that I could take care of myself. And I have ongoing checkups. I just had a CT scan. My left ovary is normal. I had a blood test, a tumor marker. Those are normal. So the greatest application of the teachings, I apply the teachings everywhere in my life, in my work to improve my relationships, improve myself, increasing my own ability to connect with people. Whatever it is that I want to create, a greater atmosphere in my office, I focus on that. I use it, to create wealth. But the most critical application for me personally, and the most humbling, was really when medicine, my own field, could not help me anymore. And I had to rely on what I was taught here, and it did work. And it did save literally my life. I might have still have a plastic drain in my abdomen if it was not for what I learned here. But I did it wisely. I always did it in conjunction with medicine, and I always acknowledged where was my own acceptance level of doing this. And with these experiences that I've had, it's now definitely increasing, and I'm progressively using it more. And I'm very grateful for it. Thank you for coming.